So this is the side lying position. Side lying position is really simple. One leg is straight along with the body, and the other leg is curved, or bent more actually, just to keep the body from rolling over. If you're working with somebody that's rolling over a lot, you can push the leg further up, which will just give them more stability. So then we'll work again on the shoulder and the neck, and I'll show you some points that can relieve neck headache pain that runs like this. Pretty much when somebody says they're feeling a question mark headache, that it starts in their neck, goes around the ear, through the temple, to the side of the frontal lobe. These are some points that you can use to relieve that type of pain. One point is right on the ridge of the trapezius muscle, where the neck and the shoulder meet. And another point is right in between the bony part of the shoulder and the neck. And I don't just press right in because I feel there's a lot of softness here, so I'll just look with my fingers, and I find that spot right here. So all it does is just takes a little bit of looking. It's like you're kind of poking around, you know.
What are you looking for?
Yeah.
Just a tense fiber.
Oh.
You know, it's like the difference between touching something soft and the difference between touching something hard. Something hard will push back at you, whereas something soft will give way right at your fingertips. Yeah. So bring the receiver's hand on top of mine and get a little closer. Basically, I'm fully supporting her hand, her arm with mine, with my fingers on her shoulder. And the other hand comes, so she's kind of like lying like this, and I can feel her scapula pushing into the side of my leg. So all I do is just roll her over, which gives me, here I can have access more to the side of her neck, but if I want to work her traps, all I do is just roll her over. So whatever you want to work on, just make it comfortable for you to reach, right? So now I have access to all of this. So then, if I put my hands together, and I do this simple clockwise motion, basically bringing that arm up and bringing it back. Down, forward, back. And then when I come up here and it's time to bring it back, all I do is pull. I wouldn't even say pull, but find the tension and press into it. Now here, her trap is in extension. It's being stretched out. When I bring it here, it's not extended at all. The muscle is soft. I can't really get a lot of definition from it. So bringing her in this position will allow me to feel more tension. So I bring my thumb or fingertips into her trap. Mary, do you feel any sensations traveling up the side of your head and your neck when I press here?
Yeah, a little bit into the neck. Oh wait, there it goes. Just give it a minute.
Yeah.
Now we've reached the side of the head.
So how I found this? Just by looking with my fingers, just by seeing what pushes back at me. So I'm going to that spot right in between the two, and here there's not much tension I can feel, but if I keep going down, back, I can tell there's something right in here. How's the pressure here? You feel any of this traveling up the side and into your neck?
Yes.
And to pull this back, I'm not using my arm, I'm just leaning back a little bit. Keeping my arm next to my body, leaning back.
Yeah, the sensation is going to like the occiput on the left side, the back of the skull, and now it's starting to wrap
Yeah.
a little bit.
These points don't need to be held too long, but after we do hold them, we just give it one over. It's almost like, what's a good analogy for it? Like, it's almost like you gave somebody a shot, right? And now all the medicine is in one place. Now what you're doing now is you're taking all that medicine and you're spreading it out through the rest of the body. Because if it just sits in that one place, it's not going to give much effect. You might need to give another shot in a little bit. So once you activate these points, just make sure to work the entire line. Even bringing your fingers into the neck a little bit, gently strumming over the muscle. And then after you've done that, lock your hands together. Ask the receiver to take a deep breath. Take a deep breath in. And on the exhale, lean back. So I felt like I was slipping here a little bit. So I'll readjust to get more of an edge with my hands. Pull her back. Mary, take a deep breath in. And then just lean your body back. Deep breath in. And exhale. Always being gentle with the arm. Once you're done, you don't want to just throw it. Okay, any volunteers that'd like to receive? Yeah? Is she gonna come? Right down here, sorry. Good. So you see how her legs are curled up? Perfect. Yeah, one leg down, one leg up. So I come up and I sit next to her, where I feel comfortable. I feel like maybe I'll be more comfortable here. And now once again, she's very rolled out. I can't really see where I would be pressing. So all I do is I just roll her out and bring my knees closer. Once again, just all I'm doing is I'm lightly pressing. I'm seeing where is the tension? Where is the part of her body that pushes back at me? Looking from the tip here up into the neck. So this is bony, feels bony. Okay, I feel like something in here. So like a cable almost, yeah? So I strum it, almost like I'm just going over it, back and forth. How's the pressure? And if I don't want to use my muscles, I just lean back. Use my center, use my core to apply all the pulling. So now look, I'll come to the place where the shoulder and the neck meets, literally. Find the center, place of tension here. And at the same time, pull back. And here I can rest my elbow on her hip a little bit. So I don't have to do any work. I can just do as little work as possible. Nidra, how does that feel? Do you feel anything going up the side of your neck? And you may not get a referral, you know. It's going. So give it a minute. Even less. Then I'll come to an area right in between. How about from here? Just like with cuddling, when you're trying to find that perfect spot to place your hand, once you put your hand on that part of the body, you know it. You know, like, oh, this feels right. Same thing with looking for these points. Let your fingers just guide you there. Once you're on them, you'll know it. There'll be a response from her body into your hand, or from the receiver's body into your hand, and you'll know you've got something. So trust that. And then we just briefly work the muscle again, and shot the medicine in. We're allowing it to spread through the rest of the body. Deep breath in, and exhale. Deep breath in, and exhale. Deep breath in and exhale. And as I pull back really slowly, almost like pouring my weight backwards. Alright. Find a partner, find a new partner, or go with your same old partner, or and grab a mat.